Alrighty. So stretching, some quick tricks if you really want to get results as quick as you can. And then a couple ideas that I've played with a little bit, integrating with some Wim Hof stuff, breath holding basically, for pressurization and depressurization of the cranium while mobilizing. So I'll kind of orient my approach to stretching of some basic tools that are used for all kinds of different specialized stretching modalities, and they trademark it and all kinds of fancy stuff and try to get you to pay a bunch of money. So I'll try to give you my best approach to get as much out of this as you can and understand different ways to stretch any area of your body. So two main polarities that you can understand for stretching would be if it's a static or dynamic stretch, and then if it's an active or a passive stretch. So a static stretch would be holding still. Dynamic would be where there's movement. Active would be actively using my muscles to reach and stretch maybe the opposing group usually. This would be considered a passive stretch even though I'm using my muscles, because it's not like the opposing group. The kind of physiological principle of reciprocal inhibition would be the fancy term, where activating the opposite muscle group triggers relaxation in that one, so it is a trick to get deeper. Active would be activating, passive would be just resting. Then you got the Wim Hof breathing stretching technique where he does where it's more engaging the circulatory system that's we're becoming aware of with all that wonderfulness. So I'll show you kind of a few different stretches to give an idea of how to work with different areas. But essentially, it would take forever to show you every stretch you can do for every one of these body areas. So I'll just show you some basic areas and you can figure out the rest on your own. If you have specific questions, let me know. I'll do what I can to answer them or send you to somebody that will know and I don't. So like for the jaw, hope my hands are cleaner. Pulling straight down with our hands kind of on our molars and teeth, and gripping around them can be good too. But just pulling straight down passively would be, or without resisting or reaching into it, would be a passive static stretch. A passive dynamic stretch would be pulling down with my hands but keeping my jaw relaxed and then moving it back up. An active stretch would be the dynamic stretches are often integrated with breathing, as well as the active, like contract on the inhale, then relax on the exhale, or contract for a few breaths, then relax for a few breaths. Move into it and hold for a few breaths, move out of it for a few breaths. There's different examples. You could stretch the jaw kind of down and sideways. I do that rather than actually stretch it directly sideways. Especially for those who don't have incredible jaw mobility, it's a lot easier to get into it. You'd need to own the movement before you can really stretch into it. I don't want to cause issues here. But again, listen to your body, use your best judgment. I can't tell you what the nerves are telling your brain about what's happening in there. So in some ways, you're always going to be the one with the best information. But you could do where I'm inhaling. This would be kind of helping with my hands, but also reaching. So active dynamic jaw stretch for depression and lateral shear would be one way of thinking about that. Everybody's got some fancy names. Find one that works for you. Call it the funky jaw to the left, whatever. As long as you know what you're talking about and you can keep track in your notes. Another good way to stretch the jaw would be forward back. Since I'm pulling on my teeth, obviously if it hurts to pull on the teeth, don't do it. If the tooth feels loose, don't pull on it. That's what I'm saying, like grab around the whole thing. Mine feel great, so I'm not worried about it, but you listen to your body, do what you need. That one I was pulling out, and then I was actually resisting for a breath, activating these muscles, becoming aware of tension there, and then relaxing that tension out and feeling the stretch on them. So increasing awareness of the tension in the muscles, then relaxing out. There's one scientific-y thing I've read about where they're talking about how if right after a contraction of a muscle, there's a few seconds there where it can't resist the stretch as well. It's like inhibited from it. So I won't bore you with the fancy sciencey terms, but it allows you to get more stretch after you contract the muscle. So contracting the one you're trying to stretch can help you relax it deeper. Some people this works better for a slight contraction, some with a more intense contraction. I think both work, but use what is working for you now, and that could change too. Go with the flow, it's an adventure. For neck, you could stretch straight down, and that would be flexion. If it was an active stretch, that'd be passive. Active would be pulling my chin to my chest. You could stretch it to the side. A great stretch, I'll show you specifically for the platysma and hyoids, because those are, well, kind of tricky. Works great is, shift the mic a little bit here, putting your hands on your chest and kind of, I like to drop the shoulders down and back so I don't get too up here. That triggers contraction of that pattern, but engage the skin, pressing into it, and then pull down a little so you feel some tension. Then you're gonna lean the neck back and reach the chin up. I have found it's helpful both to just do this or to actually protract the chin forwards. That can increase the stretch. I'm really good at tightening this. Jiu-jitsu stuff, learned to resist choking as a kid. Stupid human tricks, but the flip side of that is now I'm really good at holding it tight. So it needs more work. I'm not as good as leaving it relaxed. So here, you can also kind of engage the skin over here more and lean to the other side. Same thing over here. Try turning. Encourage you to explore safely, slowly on your own. Play with all the little angles, stretch to the side and then turn the head a little. Oh, that gets that little knot that I was working on in the back of the neck. Maybe it really gets that SCM. So try different angles, but have one exploring different combos. You could reach the head forward and then pull it down versus just pulling it down, like keeping the chin tucked and then pulling the head down so the head stays back. We'll probably get the suboccipitals more versus really leaning the whole neck through is going to get more of the post-cervical. What else do I want to do for stretching? Tongue, I'm going to do that in a separate video because these are getting a little long. Because I keep forgetting to grab the stuff. Ears, I wanted to show you specific stuff for the ears. So it's good to grab like the base of the ear rather than just the edge. Try to really grip with your whole hand so you get as much of the base of the ear as you can. I'm grabbing like ring finger, middle finger, and pointer finger with the whole edge of my thumb there, and then pulling straight out. And you can move in the 4 different directions: up, down, left, right. You can also twist. Twist the other way. You can do this 1 at a time, 2 at a time. Here I'm kind of like, again, the thumb is in here, but now the fingers are back here. Still trying to get as much of that base of the ear as I can so it really gets into the closer to the inner ear rather than stretching the cartilage. Slight pain's generally okay to work through, but again, use your judgment. If it's uber sensitive, you don't want it to flare up. I'm guessing most of you in the Wim Hof group are probably able to work through stuff a little better with the breathing, so I'm gonna assume a little more aggressive approach is okay, but it's up to you to decide. This is a self-care program. You want to increase your freedom and ability to respond to different things that come up in life. So yeah, twisting. Another thing you can do with the ears, and this kind of goes into the next quicker results thing I talked about. You can apply a stretch to the ear and then move the jaw. And the jaw joint's like right here, and the ear's right here, so you can see how they're probably connected with that connective tissue, the fascia that you have heard about that permeates every cell from the nucleus all the way through the cell membranes, through pretty much every tissue in your body. Every tissue in your body. So that's good. Sometimes I'll do like grabbing the hair, what little I have left, and pulling the ear. That can be nice too if you want to try it, but I start with the jaw. It's a little closer. Another nice one to do for more aggressive, compress and stretch, called pin and stretch. I've heard of this form of massage called, or therapy called active release technique, which as far as I can tell is just that, but I'm not certified in it, so I don't know for sure. I don't know. People make a big hullabaloo about one technique that works. It's aggressive, so I do that after you've massaged and stretched it more conservatively. You can also kind of pin and glide with or without lubrication, or on the scalenes that'd be like so. If you get areas that just don't listen, I might start with the myofascial release or get into it with this. That can really open things up more aggressively. Or if you've actually had massage on these areas and doesn't seem to be affecting it, you can try some more aggressive techniques and you might get some results, or ask your therapist to try this stuff too. I don't know. Oh yeah, if you're using lubrication, that'd be like a glide. If you're not, that'd be a stretch. I think I just lost video.